The Nuffield Trust's 2011 Annual Health Strategy Summit came at a critical time in UK and international healthcare reform.
The challenge for the modern NHS is to reflect and meet those needs, those expectations, and frankly our ambitions for an NHS that is amongst the best in the world in the 21st century.
These are economic hard times, tough funding or rationing decisions will need to be made. But what will be needed if it's going to work, if these reforms together as an overall set of reforms are going to deliver particularly the efficiency challenge?
So what is the problem that the Secretary of State and the government are actually trying to solve? At a time, incidentally, when public satisfaction rates of the National Health Service are at an historic high.
We have some very successful reconfigurations, and the ones that I've seen be very successful have largely been the ones where GPs in particular have stood up on the stage and told the story.
If there were no white paper, if there were no bill, if there were none of that, actually many of these pressures would still be there, and many of the consequences and the difficulties that we are all grappling with would be exactly the same. I actually think we will be less well equipped to respond to them.
Health leaders at the summit examined the challenges facing the new generation of clinical commissioners and how commissioning could be strengthened.
Less than a quarter of GPs agreed that the proposed reforms will improve the quality of patient care provided by their organisational practice. But GPs who were more actively involved in commissioning were more likely to think quality of care would improve.
What happens if adjoining GP commissioning consortia designate different services? And so you have a situation where trusts in nearby areas have to make different decisions.
In the end, this is going to be resolved when some company decides to say, I want to lever open that service that has not been tendered out, I didn't get the chance to tender for it, I have the right to under any willing provider. And that's where this utterly crucial decision will be taken.
Competition was a key theme, with speakers reflecting on how competition policy should develop.
We really need to open up the NHS to make it more competitive, more responsive, more transparent, cutting out waste and bureaucracy.
Several types of levers that you might use are out of bounds. For example, there cannot be price competition, we are told, and price competition is generally considered fundamental in most markets to improve performance, and there are very good reasons why in healthcare you wouldn't want pure unfettered price competition.
If an alternative provider has, whether it's another trust elsewhere in the health service or a private sector provider or a not-for-profit provider, if there's an alternative idea how diabetes care in a particular locality can be better delivered, then I would unapologetically argue that those alternatives ought to be considered before a commissioner places the contract. Otherwise, what on earth is the point of having a commissioner in the first place?
The potential for new technologies and information systems was recognised as a vital way of helping health systems meet the challenges ahead.
We need much better knowledge base out there, and a knowledge base that both professionals can use and also communities can use in order to allow services to improve in a way that meets patients' needs.
This wonderful slide shows like an example of the different coloured people representing their different needs and the different cost implications. What we're looking for in the future is to say, how do we allocate resources to a general practice population based on that profile of needs in the population?
Unleashing dynamism within healthcare systems was a major area of debate, with leaders exploring how people and organisations can become more empowered and more effective.
How does any health system tap into what I'd call the collective intelligence of itself and of its society to come up with better solutions? The knowledge of the nurse, the doctor, as well as the clinical experimenters, but also the knowledge in the heads of patients, communities, and so on.
We have a collective responsibility for securing the best services and hopefully the best outcomes against the measured needs of a population within the resources that are available.
If we really want to crack health in this country, then we've got to stop obsessing about the structures of the NHS.
The modernisation of the health service is a big shift, So power away from me, away from Whitehall, to the front line. Realising creativity and talent for the NHS for the benefit of patients, realising the enterprise and innovation latent within NHS staff, which they have, I know, by the bucket load.